The following interview is between Rachel Little, health editor of Mother and Baby and Practical Parenting magazines, and Dr Hilary Jones, practicing GP and patron of Meningitis Research Foundation. They are discussing the diagnosis of meningitis in little ones.
Meningitis means there's an inflammation of the meninges, which are the covering membranes of the brain and spinal cord. And it's this inflammation which leads to the symptoms of meningitis. In an adult, the symptoms are often very classic. A very severe headache, a high fever, neck stiffness, a dislike of bright lights, nausea and vomiting. Those are the classic symptoms. There may be some of them, there will rarely be all of those symptoms. And if you're unlucky enough to develop the septicemic form of meningitis, where there's blood poisoning, you'll often see a dark red, purpley rash in the skin, which doesn't blanch if you press a glass tumbler against it. And if you see that sign, it's a very important sign to get yourself to hospital ASAP, because in that situation, minutes count. In babies and toddlers, the symptoms may be more subtle. What you're looking for in a baby is a baby who is off feeds, who is maybe vomiting, whose soft spot on the top of the head is bulging or feeling tense, a baby whose skin has become blotchy, whose cry has become shrill and high-pitched, a baby that you don't recognise as connecting with you as a mother or a father. Perhaps they're staring into space, perhaps they're drowsy, and their conscious level is falling. I think if you see any of those signs and confirm that there's a temperature as well, those are important signs not to ignore. It's a sign to get further advice immediately and possibly to be even more proactive and take your baby to hospital straight away. Meningitis is an illness which progresses terrifyingly fast sometimes. It's not at all unheard of for a baby or a toddler or an adult to be right as rain at 8 o'clock in the morning and extremely ill by the evening. So minutes count. The symptoms as they progress should be carefully monitored, and if someone even suspects that it might be meningitis, they need to get help very quickly indeed.